In the heart of Yorkshire, our health service is hard at work.
Barnsley A&E.
They'll be here in a minute.
A dedicated team working around the clock in Casualty.
Just waiting for that bed to be ready. Push, push, push. I've got ambulance crews all the way up that corridor.
They're with us for our most vulnerable moments.
Don't get upset, you'll get worse.
God almighty.
Sorry.
Facing life and death. Trauma and tears.
You've broken that arm quite badly.
Supporting each other through the toughest shifts.
They need a medal in there.
Come on.
I feel like her off a Titanic.
This is Barnsley Casualty 24/7.
I cannot believe that.
1, 2, 2. I'll get the biscuits out later on.
I love you.
I love you.
On shift tonight, Junior Dr. Dean Mart
You're just in Barnsley Hospital. Yeah. Looks like you've had another fit, matey.
Sister Benita Wainwright,
Can I just turn you around, sweetheart? Because you shouldn't be sat like that. What have you done?
Registrar Dr. Dan Buick,
So you've got quite a nasty cut under that lip, okay? That comes into your chin. It always looks worse straight away.
and volunteer Jane Allen.
The most important trolley in this department is the tea trolley.
So get ready to share a shift
The other thing to mention off your scan is you only have one kidney.
God, the amounts he drinks on a weekend on one kidney is still going.
at Barnsley Casualty. It's the start of a new shift at Barnsley Hospital.
Right, Dad. All right. I'm all sweaty already. I've only been working like 10 minutes.
Over 300 patients are expected over the next 24 hours, and beds are already in short supply.
So, surgery is tight. Ortho is also tight. Gynae, none. And one in ITU.
Sister Benita is managing the casualty team.
No Daniels, no beds anywhere. No. So if they don't need to be here, please send them home.
Demand is growing and growing and growing, but I would say that nurses routinely go above and beyond their job roles to make sure that our patients are looked after.
I know every pillar, one pillar coming up. How's that? You'll try that now, my dearest.
I'm just going to go and check in CDU because I haven't been round to see who's gone.
She's responsible for the care of every patient as they move through casualty.
Sometimes I think, I don't know why I do this, and that's not because I don't love my job, it's just because sometimes the stresses are huge.
Junior Dr. Patrick King is new to the casualty team.
Hello there, Barnsley A&E. Yep. So that's a 59-year-old lady. Tachycardia, how fast is it going?
Paramedics are bringing in a patient with a critical heart condition. They'll need to go straight to resus, reserved for casualties' most serious cases, if there's a bay available.
You got space?
Not currently, no.
We've got palpitations, chest pain, borderline blood pressure coming in.
That one's going to go in.
Can she come out now? Blood pressure's 93/62, but she says that's normal for her. She's quite hypertensive. The resus area in A&E is the sort of glitz and glamour of A&E, really. It's the high stakes, high risk, but most challenging patients that you can deal with. I think when she arrives, you want to get her on the monitor? I can have a bit listen to her chest and go get into my access. Unpredictable things are often where you get the best experiences from, is what I've learned. So you just have to dive head in and meet it as it comes. Good afternoon. Yeah.
The ambulance crew measured 59-year-old Wendy's heart rate at 160 beats per minute.
Hello there. Wendy.
At 1 o'clock, when they started to feel palpitations.
That's more than double the normal resting rate and puts her at risk of heart failure and permanent damage to her vital organs.
Nausea, no vomiting.
All right. Feels awful. Just going to get you moved over onto this bed.
Okay, lay down.
There's a complication. Wendy has kidney failure and needs dialysis 3 times a week.
Do you have any known heart problems at all?
I don't think I had.
No?
Apart from
You never had a heart attack in the past?
Oh, no.
So chest pain started at what, sorry?
It's not chest pain, it was palpitations at first, about 1 o'clock.
Is it pain now though, isn't it?
She describes it as a heaviness, but she's scoring it at a 7, so whatever it is, it's severe.
Which is your best arm?
Dialysis this morning, came home feeling absolutely fine.
This one?
Yeah.
So,
Okay,
now
so
one of
you've
the problems that we've got is her blood pressure. That's the best one,
No, you're
98
not,
over
that's
44, but she does say she has low blood pressure.
Right.
That's a big renal, I
Yeah.
didn't realise that.
Consultant Dr. Jane Actie steps in to lead the case.
Hi Wendy, I'm Jane, one of the senior doctors. The pain in your chest, did that start at the same time as feeling like your heart was racing?
Just after. There's not a pain, it feels as though someone sat on me.
Okay, alright. So it's probably to do with the rate that your heart is going at. It's kind of essentially getting, it's like you're running a marathon at the moment.
I think
you've probably not done one of those for a while. I think the first thing is we're just trying to figure out exactly what the rhythm is, because you're going so fast sometimes we can't see. So I'm going to try and slow you down and see what it is. By slowing you down we might fix the problem anyway. But it may be that we need to give you something else after that.
There is a drug that can lower the heart rate, but the team need to check if it could damage Wendy's compromised kidneys.
What was the verdict in the deal?
The BNF is not an absolute contraindication. I managed to find a copy of the renal handbook, and that says dose as in normal renal.
Fine, good. Alright, so let's get her...
This medication can have serious side effects.
Don't want to make me pass out.
It doesn't make you pass out, no, it just, like I said, your heart rate's going at about 160 at the moment, and it'll probably slow it down to about 50 or 60, which is probably a normal rate, but to go, you wouldn't normally slow down kind of within 20 seconds.
Yeah.
So it's just a slightly odd sensation of feeling like your heart's about to stop.
Right, is everybody ready? Okay. And 6 given. And flushed. You're right. Just go through it. You're feeling better in a second.
How you feeling? About a bit lightheaded. We'll just check your blood pressure again, alright. I get 12 drawn up, kind of, that's alright. So that, I suspect it did slow you down in the middle, but unfortunately you're back up to what you were before.
Wendy's heart is still racing.
It's alright.
The casualty team need to take more drastic measures. Sister Benita is running the hub at Barnsley Casualty, and the patients keep piling in.
We've got no beds, basically. Medicine's really tight, surgery's very tight, ortho tight, gynae no, CCU, 1 and ITU 1. Peds have got 6.
But today, the area under the biggest pressure is resus. In Bay 3, Dr. Actie is overseeing the care of kidney patient Wendy.
I'm just going to sort out your oxygen because it's all a bit on skew with.
She was admitted with heart palpitations. The medication to control her dangerously high heart rate failed. Now Dr. King is going to apply double the dose.
A lot of it is trusting your judgment and saying that, yeah, I can consider these things, but looking at the picture on a whole, I think that this is a safe option to go with, and I'm happy with this decision. Okay.
Yeah, that's 12.
Is it 12 milligrams, 4 mils of 3 in 1. Okay. And given. flushed. Doing all right, Wendy?
What's changed?
Oh.
Okay, it's just your heart rate slowing down.
Nearly over, nearly over. Just ride it through, Wendy.
Has it worked?
It's definitely worked. You're back in a better rhythm. Your blood pressure's a bit better. You'll feel this better in a minute, I promise. You probably don't feel it at the moment. You probably want to wallop me one.
That heaviness has gone out my chest as well.
Perfect. Have you got any pain left at all?
No, it's gone. Good. It's gone.
It could be if your bloods are okay and you remain well. Often with SVTs we send people home after a couple of hours of observation. It's just obviously you're just such quite a complex patient. It's just making the decision whether that's right for you or not.
The patients are still flooding in, and volunteer Jane is on hand to offer some traditional Yorkshire hospitality.
The most important trolley in this department is the tea trolley. Most important. So it needs to be kept prepared and clean at all times. Well, I still believe that a cup of tea will fix everything, but obviously medically it'll not. But yeah, a cup of tea helps anyway. I'm not saying it fixes everything, but a cup of tea definitely helps. I wish I could be like that Martini advert where they've got roller skates. My work family is different to my family at home, obviously. But yeah, I've got very much a work family. People that I know I can rely on, talk to, have a laugh with.
And in the hub, at the heart of the Casualty family, is Sister Bonita.
The Great North Run, she fell. They keep saying exercise is good for you. I haven't seen any evidence at all that exercise is good for you. She fell. She could hardly walk on Monday. Do you do any exercise, young man?
Do you, Jane?
Me, I go to the gymnasium 3 days a week. I do a pilot's class, and then I do an aerobic class. And it's 1, 2, 3, and I do an aerobics class on a Tuesday morning. Pilots on a Thursday morning, but I'm not very good at that.
Is that Pilates?
Is that what I just said?
You said pilot's class.
Same difference.
Pilates.
Same difference. You get a mat, you lay down. But the most exercise I get is my jaw. You fall off things.
Paramedics are rushing a man injured in a building site accident into resus. Nurse Abby prepares Bay 5 as consultant Dr Liz Doherty examines 41-year-old Rob.
Can you manage to sit forward and I can have a look at your back at the same time, or is it too sore? So what we tend to do in this situation is we're obviously just going to get some bloods off, make sure everything's checking out okay with those, and then we're going to get a detailed scan of what's happened to you, the way it's come down.
Rob's mates brought him into Casualty in the works van.
Well, we pulled him out, got him off of the scaffolding, put him into a van, decided what we were going to do. We just said Barnsley, we're 10 minutes round corner because we're not from round here, we're from Rotherham. So we just brought him straight through here. Put car in a disabled space, ran in, said we need some stretchers, we don't know what we're doing, where we're going, and here we are.
So we'll just get this pain relief up and then we'll get you around to a scan. Do you want a blanket to cover your legs while you go round, or?
Yeah, I'm alright.
Are you sure?
I'm not shy.
You don't mind flashing people on the journey? Resus can be quite busy, quite hectic. You never know what's going to come in, but I like it.
I hate legs like this, it's just my ribs that's hurting.
You learn a lot about patients through just having a conversation with them. Sometimes they can be quite surprising.
So that's initially what we're just doing. So these are the trestles that we're building.
It's bigger than I thought.
Really high,
Yeah.
really high up. And the entire thing's just fell forward.
Yeah.
And the guys were stood on this beam back here. Yes, that's Robert in the middle there. If he was stood on the beam, there would have been no give whatsoever from the fall. And that's where they were trapped into there. Well, you can see, oh, wait, there he is. There's Robert. He is in the picture, he is there.
So I'm not one of these people that decided that they wanted to be a nurse from being a child. I kind of fell into it. I was a healthcare assistant in a nursing home, and then one of the nurses there said, you should be a nurse. So then I decided to do my nursing. I just applied and there I was.
Ankle feeling rough then, Bob?
Aye?
Ankle feeling right rough.
Oh,
Is it proper swollen up?
oh, it's like a balloon, man.
While the medics are busy in the other bays, the lads can't resist a bit of building site banter.
Don't give him sympathy. What a job at him, he'd be crying, wouldn't he?
He'd have been airlifted up at
Yeah.
Yeah, he would have been. He would have been out.
Bring back in helicopter and that, wouldn't he?
What's pain like now?
It's about a 5. She's got a laugh, hasn't she?
Not too hard, though.
Yeah, no, definitely not too hard.
Thank you very much.
Rob's taken for a scan to see if the fall has caused any permanent damage.
This lady I need to find out about.
Sister Benita's job is to manage the flow of patients through the hub's often overcrowded workspace.
One of my massive bugbears is finding patients on the corridors.
Can I just turn you around, sweetheart? You shouldn't be sat like that. What have you done?
We've only got 11 cubicles, so once they're maxed out, then overspill is corridor space.
What have you done? What have you done though?
Oh, falling.
What, from standing?
From walking, walking quickly.
I'm my own worst enemy when it comes to delegating. So 9 times out of 10 I end up doing what I would like somebody else to do. And that's why I always have 10 jobs on the go.
So what were you doing? Coming back from yoga?
Yeah, trying to keep fit. I mean, why bother?
Do you know, it's funny you should say that. We've been having a conversation about fitness this morning and injuries sustained through it.
So you want IV paracetamol?
On duty in resus today is Dr. Mart, originally from South Africa.
I came after medical school just to see a bit of the UK, and as you know, every old adage goes, you meet a woman, you end up staying. Here I am, 20 years later.
A bay has just become available for his new patient, 65-year-old Alan, who has a serious head wound following an epileptic fit.
Yeah, I don't have a side.
Hang on, Alan. Nice and calm for me.
Ready, set. Okay.
He's an owned epileptic, and we
Yeah.
believe that his epilepsy alarm has contacted Citywide, who have turned up, like a care company that provides.
Yes. Okay.
They found him face down on the floor in a pool of blood.
Yes, where? At his own home?
Outside his own home.
Oh, yes. Okay. Alan, so we can get that off. Go on, keep going.
Being quite agitated.
Yes.
Temper 34.7.
34.7, yeah.
Yes, and a BM of 8.
BM of 8. Okay.
Hi. Hello. I'm just going to shine this torch in your eyes, okay? Open this eye for me. That's it. Let's have a little look. Open your eye.
You're just in Barnsley Hospital. Yeah. Looks like you've had another fit, matey. Yeah? Alan? Okay.
Alan's sister Linda arrives.
Hello. Hello.
Alan, I'm just going to
I'm
put some
Dean,
more
one of the
stickies on
doctors.
your chest, okay?
Ambulance crew brought him in because he looks like he had a fit. Okay. And he's bumped his head quite nastily.
It's a bit of a shock when you see him looking
It looks
like that,
looks
isn't
worse
it?
than it is.
Worse than it is, I know.
Okay, so they do bleed quite a bit.
But it takes a while to come out of them.
How long?
He's got a subarachnoid
Cyst.
They operated to debulk it.
To debulk it, yes.
But they weren't able to take it all without taking.
Is that the source of his epilepsy?
Yes.
Yeah, okay, fine. Getting information from relatives is vital, both in terms of what has happened on the day to have brought that patient in there, however, also their past medical history.
He's lived with this condition for about 30 years or so. But always cheerful, always says he's fine, you know, doesn't tell you that there's anything wrong, doesn't like to bother you, sort of thing.
He's now having trouble with his breathing.
He's got lots of mucky stuff in his airway, hasn't he? Sorry, matey. He's probably pooling secretions down the back of his throat. Right, are you... Oh, wonderful, thanks.
Once Alan is stabilised, the team take him for a CT scan to check for internal bleeding in his head.
Move.
We know he's got epilepsy, so it doesn't, the fact that he's dropped his GCS doesn't bother us that much. The fact that he's had further seizures.
Hold your breath. The cyst that he has on near the brainstem did start to change, so they eventually did operate to try and reduce it a bit, but they can't take all of it away. But you know, he's still cheerful.
At the minute, I'm going to make sure he's not got any bleed or contusion into his brain.
And it's a worry that is it starting to grow back again, and that it's going to progressively get worse, and it might take his independence away from him.
Cheers, guys.
300 patients have already come through the door today in Barnsley Casualty, and there's still no let-up in Rhesus, where roofer Rob has just got back from an ankle scan after a building site disaster. Dr. Doherty has the results.
Your ankle unsurprisingly is broken.
Yeah.
Yeah. And it possibly needs an operation to fix it. I'm afraid.
This is what Rob and his building buddies had feared. But there's a surprise in store as well.
The other thing to mention off your scan is you only have one kidney. That's been the case probably all your life.
What?
So yeah, that's a bit of a random finding.
God, the amounts he drinks on a weekend on one kidney is still going.
Yeah, but that's important for you to know.
I cannot believe that.
All right.
Right.
Yeah, nothing you want to ask.
No, that's it.
On your way out.
How have you been going on one kidney? That still stunned me now. Rob!
Oh, that's a finding, isn't it?
Right then. Lift your leg up for me.
It's bad news for Rob, but there's one bit of good news for the builders.
While he was getting checked out and stuff, his phone died, and he wanted to get his phone charger, go on and cash out on a bet, because 4 out of his 5 horses have won. So he was like, I'm cashing out. And they were like, I can't cash out now, if I lose I'm going to be right, man. Last horse won and he's more than doubled his money now.
Fab. Well, that's your luck for today then. I think most people do try and see the light in every situation, so positivity is seen a lot in A&E. Is that all right?
Yeah.
Not too painful?
No. I'll cope with it.
Nice people do make your job a lot easier. It means you can have a laugh and a joke with them and get on with your job and get on with your day.
Rob had an operation on his ankle the following day. He's back at work and the roof is now safely up. With Casualty at full capacity, Sister Benita needs to keep the department moving.
Sometimes you can have that flow and make it work really well, but then other times you don't, and it is really upsetting. And all that is just numbers and the stress and demands of that department.
Has anybody done Mrs. Slater's ECG?
Who's 9ED?
She has to keep track of up to 90 patients at a time.
Shaz, this lady, Marsden, will need some bloods doing. And I'll...
Have them done that there?
No.
See how Margaret thingy did it?
But there's some good news over in Rhesus. Kidney patient Wendy, who came into hospital with heart palpitations, is waiting to be discharged.
How are you feeling in yourself now, Wendy?
A lot better.
A lot better, yeah.
Nurse Christy Horn keeps her company.
How long have you been having dialysis then?
10 years.
Oh gosh. A while then, isn't it? It's a long process though.
It is.
You have to plan your life round it, don't you?
Yeah. Don't get me wrong, it does get you down.
Takes it out of you.
You do your crime behind closed doors and come out with your face on.
Yeah.
You know what I mean? You ain't got a choice for it.
Yeah.
You either want to live or you don't. That's, you know, there's no else.
You sort of just have to make best out of the situation.
Yeah.
You've been given, and yeah. Well, that's all you can do.
When you have a family, it's...
You got kids, grandkids?
Yeah.
Hmm?
Yeah.
How many?
4 kids, 14 grandkids.
Oh gosh.
1
14.
great grandson.
How old is he?
He's 8 months.
Oh.
Yeah.
14.
So that's why I dialyse 3 times a week.
Well, you want to carry on seeing them, don't you?
Yeah, that's it.
Carry on seeing them, carry on being around.
Yeah.
It's a good reason, though, isn't it?
It
If not
is.
for yourself, then for them.
Yeah.
Hey?
Yeah.
Oh, it's lovely.
Wendy's heart rate stabilises and she can be discharged.
Right, I've got everything off here.
Yeah, got all your belongings.
Thank you very much.
All right. Nice to meet you.
Yes,
Hope you
you
get
as well.
sorted. Thank you.
She leaves with her partner and is now back home with her family.
Design floor.
Volunteer Jane is back on her rounds with her trusty tea trolley.
I'll indicate that way. Now then, tea or coffee, dear?
Tea.
1 cup of tea and no sugar? No sugar. Sweet enough then, are you? They are, my cherub. Some patients are over the moon that you brought them a cup of tea and some toast, and they even offer to pay for it. You know, I've had patients and relatives, how much do we owe you? You owe me nothing. It's a cup of tea, it's a tea bag and a bit of water. And... Tea or coffee?
Coffee, please, no sugar.
Coffee, no sugar. I'd like to think that we give patients more than just hot drink. Sometimes just a bit of plain, simple banter, it can make all the difference. You don't look right happy today.
No, I'm struggling to see.
Are you? What do you see when you see me?
Right now, I can recognise you, but if you stand 10 foot further back, it's just like...
Do I look like Angelina Jolie or Jennifer Aniston, the further back I go? How about... Yeah. No wrong with his eyes, is there? I keep telling him there's no wrong with his eyes. Eh? You're hearing all right?
Rhesus is still packed with patients.
What a busy afternoon. The morning was nice.
Dr. Mart has been treating Alan, who came in with a serious head wound after a seizure.
God, that's quite nasty, isn't it?
His sister Linda is by his side.
It's quite nasty. Knock on your head, really nasty. You don't want to look at this, do you? It is very deep. It's all the way down to the scalp, yeah. So just that little flap was causing a problem.
They're waiting for the results of a CT scan to see if Alan has suffered bleeding on his brain.
The only acute thing is he's gotten a fracture through the front, exactly where that wound is, yeah? C-spine looks fine. No injury. Okay, that's fine. Good.
Right. Oh, hello. Another sister. Hello, what's your name?
Younger sister. Janet.
Janet, hi, my name's Dean. So I've been looking after Alan. So the good news is there's no obvious bleeding inside his head. However, he's got a skull fracture underneath that point that goes into his sort of frontal sinus. Alan will stay here overnight. Any questions? No. No? OK. Good.
As Alan slowly comes around, Sister Vicky Walker arrives to clean him up.
Alan? Hello? Right, so I'm going to wash your face and get all this blood off. Is that okay? Oh dear. You've got a fat lip. Do you know where you are, Alan? Oh. No, you're not. You're at hospital. Can you remember what you were doing today?
Can you remember where we were last night? Football, weren't we?
Oh, did you go to match? Barnsley match? Oh, I bet it was cold, weren't it, on that stand?
Yeah.
Take my hat off to you, like. I couldn't stand there for a couple of hours in freezing cold. No chance. Right,
Alan? Sorry, it's Laurie, one of the doctors. Can we do one more blood test from you? Is that okay?
Right, as soon as they've done this, you can go to the ward, right?
And be comfortable.
No, you're in a bit of discomfort here. You've had a really, really bad fall. You've got a bad cut to your forehead. Said to the doctor, he says you're going to have a right scar. I says it's all right. I wouldn't have won any beauty contests before. So, would you?
You're so kind of them.
Hey, Alan, take you up to the ward now. All right. Now we've done rolling you and stuff.
Leave your sheet over.
I'll keep coming with it. Come with us. Yeah.
Alan was discharged 10 days later and is on the mend with the help of his sisters. Patients are heading home, but it's still a hectic one in, one out in Casualty as the red phone keeps ringing.
Hello there, Barnsley A&E. Yeah, that's a 12-year-old, and he's been bitten by a dog.
In Rhesus, Nurse Chloe Wesley prepares for the latest arrival. 12-year-old Clark has come in with his mum.
Hello, darling. Come and have a seat.
He's been attacked by a neighbourhood dog.
What kind of dog was it?
A staffy, we think.
Not your dog.
No, a dog known to him.
Paramedics have given Clark paracetamol.
It's still painful though.
I'm not surprised. It's going to be, innit? Can I take this tape off and have a quick look? You're going to get the hairs pulled off your face. I'm sorry. Sorry. On this side again. I'm sorry. There you go.
Sorry, it's just me being silly.
So you're being braver than your mum.
It's one of the busiest days ever at Barnsley Casualty, and the Rhesus department is full.
They've got loads to see. They've got the guy with the plaster.
Adding to the pressure, the Pediatric Casualty department is packed with poorly children waiting to be seen. And 4 more have just arrived from one family. Their mum suspects they may have carbon monoxide poisoning. Consultant Dr. James Griffiths is assessing them. If they need to be admitted, the department will have to find beds for all 4 children.
So my name's James, I'm one of the doctors. What's been happening?
In cubicle 3 is mum Zoe, with daughters Shannon, Bethany and Kaylee, and her son Ryan.
What it was is we've got a carbon monoxide box in the kitchen and it's on ceiling and it went flashing. So I decided to put gas people up to see what I had to do. And they sent somebody out and they capped it off even then.
So basically, there's been like carbon monoxide leaking into house.
Okay.
So we're here to see if we've got carbon monoxide poisoning.
Okay, because you've all had symptoms, is that right?
Been sick, headaches, and just not feeling right.
Okay, but you thought it was like a bug?
Yeah.
Okay, right, yeah, not uncommon in winter. Right, so we're going to do a blood test on one of you to see if you've got problems.
Yeah.
It was volunteering.
You volunteering, Sharon?
Normally it's the grown-up that volunteers. Just keep the arm nice and straight for me. Rather than bleed everybody for the same reason, because they've all been exposed, we'll just bleed one person. If one person's got high, then they'll all be high, but if one's low, they're all low. So let's just have a look at the other arm. With all patients, try and be that calm, reassuring person that they need when they come into the emergency department. When I'm ever taking blood, warn the patient, obviously, because they need to know that they're about to get stabbed. Sharp scratch.
If they do have carbon monoxide poisoning, they'll have abnormal carboxyhemoglobin readings in the blood.
Got it? Right, let's go and run this through our machine, we're getting results. The treatment is high flow oxygen until it normalises. It's because the gas has been capped off for 2 days. It'd be really, because the carbon monoxide gets out of your system quite quickly, so if they've been out of that environment, then it'd be really unlikely for the results to be positive. But at least we've got some medical evidence that you know, that they're well. Good news.
With the whole family possibly affected, this result is crucial.
The results are in. It's good news. So the carbon monoxide level was down at 1.4%. So if it was sort of high and causing symptoms because you were still being exposed to it, it would be sort of 15, 20%. So 1.4 is absolutely fine. It doesn't require any more medical intervention. There's no more leak there, so the gas people can come in and do what they need to do. From a medical point of view, you're fine. Then you're good to go. All right, thank you.
Now Zoe and family have had the all clear, they're heading home to speak to the gas company. Sister Benita has been on shift for nearly 12 hours.
It has eased off a little bit. I got hit a bit here.
But the paediatric department is still packed. Clark arrives from Resus with his mum Gemma. The 12-year-old has been mauled by a dog.
You feeling all right? Yeah? Still feeling dizzy?
He's badly shaken and has a deep gash in his chin and lip. Dr. Buick will be treating Clark.
So what's happened today?
So he's gone in and stroked the dog and it's just jumped up and bit him for no reason. You're very brave, Clark.
The police know.
Yeah.
I've got a toddler at home who's 18 months, and so I think I possibly sympathise a bit more with parents than I did before. You just have a greater understanding of all the sort of challenges of having a child. Do you mind if I have a little look under here? Is that all right? Just gonna grab some gloves. Have you seen it yet?
No.
No. So you've got quite a nasty cut under that lip, okay? That comes into your chin. It always looks worse straight away, okay? Can you open your mouth? When you put your tongue underneath here, like this, can you feel it coming through? Is there a gap there? What I'm trying to work out is if it's cut all the way through, or if it's just on the outside.
It's nearly through, but it's on the outside.
Nearly through. Can I just bob my finger just on the inside of your lip? Is that all right? So as far as you can open your mouth. Are any of these teeth wobbly? Sorry.
Oh, is that just blood or? Yeah.
You've got a really superficial, so really shallow, just on the surface, just scratch along that surface. It's like a cut going along there. So that's what you can see where it's bleeding there. I'm going to have a chat with some people about all this, all right? And then I'll come back to you, okay? Hello, through to the plastics on call, please.
Dr. Buick sets about organising specialist plastic surgery to save Clark from scarring. His mum grabs a souvenir snapshot of the damage.
Show it you later when you've got it all. Yeah.
So, I've had a chat, you know, I was saying I think we end up putting you to sleep to then have a look at this and get it sorted properly. That will happen in Sheffield, at the Children's Hospital there. It'll happen tomorrow morning.
Right.
So what I'd like to do is get this cleaned, and then I'm going to send you home.
Yeah.
And you're going to go to the Children's Hospital for 7:30 tomorrow morning.
Yeah.
Okay.
Yeah,
Good
fantastic.
man, you're doing great. I think being a doctor with a child at home perhaps makes me a bit more of a worrier. I'm quite fussy around trampolines and dogs, perhaps more so than others.
Nurse Kaylee Cartledge patches Clark up, ready for surgery tomorrow.
At any point, if you feel any pain, give me a shout, okay? Do you want to hold your mum's hand? Are we okay?
You're brave, aren't you?
Yeah.
Oh,
I'm
it's
just
a bit
gonna...
sore there.
In other words, I'm gonna get all this off and then we'll start cleaning the wound. Is that okay with you?
Oh, be brave.
Sorry. Just gonna put this on and then we might have to leave that little bit out, you know, at the top. But at least we've got most of it covered.
Yeah.
Clark is almost ready to be discharged when his dad arrives.
Hello.
Don't get upset now, Dad's here, plonker.
Been ever so brave,
Yeah,
haven't
right. Wouldn't you get upset and all? You'll set me off.
Just gonna put this just one. How are we feeling? Good. Ready for home?
Clark's chin was stitched up the following morning at Sheffield Children's Hospital and has healed up nicely. As the night shift clocks on, it's time for the day shift to start thinking about home.
Right, darlings, I'm going to love you and leave you. No, you're not seeing me in a bed. I'm going now. Benita, when will you be working my chair?
Oh, actually, come on nights next week.
I'm off Monday.
Yeah, no, look at the bluage, the days.
It could be another 3 or 4 months before I see you. Ta-ra, darling. When I get home, I like to have a glass of wine or a gin. I feel a sense of relief that my shift's over, in one respect, and hopefully a sense of pride that I've done a good enough job during that shift.
In Rhesus, Nurse Abby has also reached the end of a long and tiring day.
I really enjoy being the Rhesus nurse. At times the job can be quite busy, stressful, but it's very rewarding and I love it. And yeah, that's everybody.
Thank you very much, madam.
You're welcome.
Are you coming back tomorrow?
I am not, no, I'm on nights this weekend.
Sister Benita finally clocks off to get her head down before a tough week on nights.
See you later, John.
See you later. Thank you very much.